of this metabolite is in the urine. So moving on towards the clinical uses of aspirin. Aspirin has a wide variety of clinical therapeutic range, and it has been used as an analgesic and an antibiotic. It has been used in the treatment of arthritis, acute coronary syndrome, migraine, polycythemia vera, coronary artery stenting, carotid enterectomy, valvular heart disease, in the prevention of venous thromboembolism, and in the prevention of preeclampsia. We will discuss the doses in a few of these diseases. As an analgesic, which is the most common use of aspirin, it can be given in the doses of 325 milligram to 1 gram every 4 to 6 hours, and up to a maximum dose of 4 gram per day. Cannot exceed from this dose. This is the maximum recommended dose. We can repeat the dose of 300 milligram every 4 to 6 hours if we are using the aspirin as an analgesic or as an antibiotic. So if we're giving aspirin to our patient for treatment of fever or pain, this is the dose that we can give aspirin in. In the treatment of arthritis, pretty high doses of aspirin are used, and we give 4 to 8 grams of aspirin per day. In the acute coronary syndrome, the loading dose of the first dose of aspirin was always 160 to 325 milligram. This is given only once. This is the first dose, and after that dose, a maintenance dose of 75 to 81 milligram is given. In the treatment of migraine, aspirin is given in the dose of 900 milligram to 1 gram, and this dose is given once. If the migraine is not resolved, we can repeat it in this pattern every 4 to 6 hours, but we need to remember that we cannot go up to 4 gram per day. This is the maximum dose of aspirin. In the polycythemia, the coronary artery stenting, and polycythemia vera, and valvular heart disease, in the prevention of venous thromboembolism, we use the doses of 75 to 100 milligram once daily. So a little bit about the adverse effects. Aspirin has a lot of clinical uses, and it also has some adverse effects. And the most common adverse effect that is seen with the aspirin is gastric intolerance. The mechanism of this adverse effect is related, or is the direct extension of its therapeutic effect, as we have already discussed the mechanism. That it inhibits the production of these prostaglandins. So there are some prostaglandins that plays an important protective role in the GIT, and when we inhibit all the prostaglandins, aspirin causes gastric intolerance in the patients who are taking it regularly or who are taking it very frequently. It can also cause duodenal ulcers, so we need to be very careful about this adverse effect. Aspirin can cause hepatotoxicity, and this adverse effect is most commonly seen in the younger patient. It can occur in adults and geriatric as well, but this adverse effect is often seen in the teens and in the children. It can cause rashes. It is very common with the use of aspirin. It can cause GI bleed, and it can cause renal toxicity. So the most common adverse effects that are seen with the aspirin are related to the GIT. It will cause GIT intolerance, duodenal ulcers, GIT bleed, and then one is related to the liver and one is related to the kidney. So whenever we are giving aspirin, we need to keep all these adverse effects in the mind, and we need to monitor patients for these adverse effects. There are a few contraindications to the use of aspirin, and if any patient has any of these clinical conditions, we would not give them aspirin. Number one, and very important contraindication is hyper sensitivity. If the patient has any history of hypersensitivity reaction to NSAIDs, then we cannot give them aspirin. If the patient has asthma or any reactive airway disease, we will not give them aspirin. If the patient has any nasal polyps, we will not give them aspirin. And lastly, we need to be very, very careful about the use of aspirin in teenagers and in the children. We do not use them in this population, as aspirin is very notorious to cause gray baby syndrome in the children. So we do not give aspirin in children. So this was all about the aspirin.